Starting. All attendees are in listen-only mode.
Hey, Rich, how you doing tonight?
Hey, guy. I'm doing great, man.
Yeah,
Ready to talk about a few devices?
yeah, we are. I'm here in Florida. I want to say one word. I hope everyone on the east coast of Florida does well, and our friends, anybody have in the Bahamas. And I know that we've had quite a scare down here. It looks like we're okay over on the west coast of Florida. I know a lot of people still aren't out of the weeds yet. And thanks for taking the time to talk to us about these devices that we do. This is, I think, one of our most popular and most requested webinars, Rich, that people, when we go to courses, one of the first things that they say is, if you'll tell me which device to do, that's all I need to know, right?
Yeah, I don't know what that is about dentists, the way we learned in school or what, but it's like, okay, which device do I make, and after they make about 10, the second most common question is, okay, now how do I get paid?
Our two most popular webinars, and I guess it is confusing when you look. There's a lot of different
out there.
Yeah, and there's different iterations and versions of each of the ones that are out there. And Rich, we've known each other now probably 15 years probably, and I know when we were working on some of our things and DS3 and our software and stuff, we were trying to find the way to make the dentist be able to help them with this decision because it comes up so much. And I'm pretty proud of our system that we've come up with. How about you, Rich? It works 94% of the time, right?
I've got my dart here. I'm ready.
So this will work 94% of the time. Or here, Rich, are you ready? We'll do the rock. I won rock, paper, scissors with my wife for the first time in 20 years the other day. She always wins that with me, and I'm always taking out the garbage or something. But, and we can play the little shell game here, too. We're saying this tongue in cheek. But there's an element of truth to what we're saying with this. We're going to go through the devices, the 5 that we use, the most common, there's iterations of those too, and you're going to get some really good information. But if you're new to this and you're just getting started, relax and realize that you're probably going to do okay no matter which one you do.
Yeah, I like to teach, guy, you can't make a wrong one, but you can make a better one.
Right.
So, relax thinking that, okay, I can't make a wrong one, but I can make a better one. So, on most of this stuff, we record these webinars. So you're going to, you can look at these again. When I deliver a device to a patient, guy, we have a little video we play that's like 5 minutes long. The first thing I say in the video is just relax, take all this in. You're not going to remember all this. So don't try to remember it all, So I think that's good advice for you, dentists, and you staff people out there tonight as well. This is something that you can review again, and you'll want to review again. But we're going to give you lots of good information here tonight. We've been doing this a long time, Guy and I have. We know a lot about this because we made a lot of mistakes, we like to say, over the years. But
yeah, we've done thousands of devices, and I think our advice will really help you get along the way. And I can tell you, Rich, I'm really excited about doing these webinars now with and our courses that we're going to be doing with DSG Dental Services Group. I've been working with them for 25, 30 years back in my dental practice. I did a lot of crown and bridge. Unlike you, Rich, I had a regular dental practice for 22 years, did a lot of implants, and they're one of the biggest labs. I think they have roughly 39 or so labs throughout the country and Canada, but that they leverage that to make it that they have all the resources, but I've always felt like I got the smaller lab customer service. Yeah. And especially when it comes to dental sleep. I know some of the first devices I ever did 20 years ago or so, I did it with DSG. They've been doing this as long as you and I have, over 25 years. I think one of the things that they're key on is they're focused on bringing these leading edge technologies and focus groups, focus products, kind of like dental sleep, to where they have experts there that can answer your questions for you. And I was talking to Michelle the other day from DSG, and she was telling me about a survey that they did to all the big labs, and they had some of the highest rated, or the highest rated, I guess it was, for aesthetics, reliable consultations, and what's most important to me is the fact that with these 200 people surveyed, they had the least amount of adjustments. And I find that to be true, especially now that we have scanners in our office. You've been using a scanner for a while as well. And I'm really excited. We're doing some courses with them later on. We'll give you that information, and we're going to be talking about sleep because that's all we do now. But understand they're a full service lab.
Certainly not all they do, is it?
No, they don't. But they have a lot of resources for their sleep department, and they do the devices that we do in our offices as well. So
yeah, so if you have not given them a try, we certainly recommend that you do. They're very highly rated, and the experience the guy and I both have had, myself with just the sleep, since that's all I've done for 20 years, but Guy was with the other things as well. So do that. A little bit of housekeeping. You will get your CE. Give us a couple of days to get that to you. Don't forget to check your spam folder. Sometimes it ends up in there, but you'll get it.
Absolutely. And last bit of housekeeping, I think, here before we get into the devices is we mentioned that the two most popular webinars that we do are dental devices. We're doing that tonight. Well, stay tuned for the next one in October. We'll be doing dental sleep medicine billing. So like you said, as soon as people learn that putting these devices in is a lot easier than doing crowns and root canals, technically, the billing becomes the big hurdle, and we will give you some really valuable information that's up to date too, because we do this webinar probably once a year, and every year it's a little bit different. We have more. It's a moving target, more information to add. So make sure you put down that date.
I better put that on my calendar too, Guy. Make sure I.
I'll ping you about it. So don't worry. You know, Rich and I have been doing this for a long time, and one of the things I think that really changed, at least my practice, I was doing dentistry and a little bit of dental sleep, and in 2006. The tides turned for dental sleep to where the physicians group, the American Academy of Sleep Medicine, changed their practice parameters to say that dental devices were indicated for patients that had mild to moderate apnea, and they could do that as a first line of therapy instead of going right into a CPAP and having to fail that. And if they're severe, they could do a CPAP first, and they can't wear the CPAP, then they have a dental device. And that's when I really started putting more emphasis in my practice into this, and in just a few years, it started becoming so busy that it became as busy as my dental practice, my dental sleep did. And I guess the point of this is dental sleep is not just Guy and Rich's opinion here. It's not something that's, well, kind of on the fringe of treatment. It is one of the two treatments that are indicated for patients who suffer from obstructive sleep apnea. And it's a pretty big deal to have sleep apnea. It's something you don't want to just ignore.
You know, that I don't remember who it was, Guy, that put that article out. You know, the last time they estimated how many people had sleep apnea was like 2007. It was like 900 million, and now it's close to 1 billion. So I don't think it's grown that much in 10 years, but I think there's enough patients out there for all of us. You know, so what we have been preaching for a decade now is that you get off your keisters and you learn something about sleep, and you start screening for it in your practice, and you start, figuring out a way to get these patients tested. And then, tonight we're going to talk about how do we treat them, which device do we make on which types of patients. And then you got to, bill for it. And this is what we call the 4 pillars. You have to have these as foundations in your practice in order to be successful in this.
And I see some questions coming in. If you have questions, by all means, type them in the question box. And we have our DS3 team answering those. If we don't get if they don't get a chance to answer them, we will answer all the questions before the night's over. So type them in there. We had over 200, almost 300 people, I think, register for the webinar tonight. So we can't open up the mics. It would get too out of control. But if any questions you type in, we promise we'll get to. And really, the question is, what do we do at night when the patients fall asleep and they're all relaxed and their airway does this? I love this slide I got from my good friend Alan Moses a long time ago. And I enjoy showing this to newbie dentists. I'm going to kind of show that again, because a lot of dentists who are kind of thinking, do I need to be involved in this? Why are dentists involved in this? Well, what other doctor, physician, dentist, medical provider is more trained in this area of anatomy? And the bottom line is most people have this problem, don't know they have it, and the ones that do aren't being treated. And so how we pull this jaw forward, how we open up the airway, even though we're going to talk about these devices today, is less important than really you getting involved and understanding that we have a solution then in most cases can really help the patient. So we'll dive right into the devices. We'll talk about Medicare next time, about why you likely should be involved in Medicare. Medicare is not Medicaid. It's the federal run health care that you'll have if you live to be 65, and which government doesn't run out of money. And it's something good to do, and we'll talk about why that is. But if you become a Medicare provider, then you don't need a dartboard or those little cones anymore. We just have a coin probably, because there's really two groups of devices: the Herbst devices and the tap. I said it backwards. The left side's the tap, the right side's the Herbst, and we'll talk about a couple different versions of each of those, but they're both great devices, and we'll talk about which ones we use where now. So again, a Medicare, they're the only two that I use for my Medicare patients. There's a few other devices out there, but I'm not really thrilled with any of the other ones. These are the ones that hold up and you really want to choose from.
So two of the devices of the 5 that we're going to talk about are the TAP and the Herbst. And now we're specifically talking about Medicare patients. So with Medicare patients, make sure you understand there's a couple other ones, but you have to use a Medicare approved device. And then on top of that, you have to have that device made by a lab that's approved by Medicare. So you're safe with DSG in either one of these cases if you decide to do that. So let's talk about, Guy, when we might use one over the other or something, because there's already some questions coming in about, this and that.
Yeah, and let's talk about the two kind of general versions of the Herbst, and then we'll talk about the pros and cons. I think maybe it'd be easier. This on the screen is the DSG SomnoDent Herbst Advanced, and the way it advances is you have a little screw. You put an instrument here and you turn it, and it moves this part on the upper, on the maxillary arch rather, moves that forward. And what's nice about this is it gives you can see really how far you've moved the device forward at a glance. So that's the advance. It is a little bulkier in the back. I think the next picture coming up, yeah. This is the traditional Herbst, and you can get either one of them from DSG. And we'll talk about the materials, the liners and all these. So we'll talk about what touches the teeth after we go through all the devices, because there's different choices of what touches the teeth. This one works by having a little barrel that you put the instrument in. We call it a barrel. And you put the instrument in, you turns it towards that dot there, and that will move that backwards, which moves the jaw forward. And one key thing, no matter which one you do, I'll back it up to show you the difference again. The patient has to do it obviously the same on both sides. So this is a little less bulkier in the back, but it's a little more difficult to turn, and you can't really see how you advanced it quite as much. They both work great. We do both of these in our offices. So we can talk now kind of, would I miss anything on the differences between the two, Rich? And we can talk about the pros and cons.
No, the advanced, it sticks out just a hair more. I don't know that we've had much issue with that, Guy, but the ruler's already on there. Right. Otherwise you either have to count turns or you have to get a micrometer out. So every time when you deliver the device and you're going to tell the patient to advance it X number of turns every week, and when they come back, you either have to turn it backwards and count the turns or get a micrometer out and measure it. So that's what we do. And that makes the advanced a little bit easier. So we might even add to the more on this advanced part, Guy, when somebody has a little bit harder time seeing that or something like that, which a lot of old people do. Heck, I have a hard time seeing it without my glasses now. So
yeah, we don't have many old people here in Florida, of course, sarcastically speaking. So that's why you have to take Medicare here. And yes, you're right, the advanced is easier for them to see. And again, they're both great. I would say this about the Herbst. And I'll steal one of my friends, Steve Carson's saying, he calls it the universal device. If you just think, I don't know what to make somebody, it's really hard to find a case that a Herbst won't work. If a Herbst won't work, most other devices probably won't either. It's if they're missing some teeth, it just kind of the way it fits. It's just a great device overall. And we're going to categorize the devices in two categories: one that allows the mouth to open, and the others that kind of fixes you together. And just kind of think about that. This one allows the mouth to open, right? Well, it's less claustrophobic. It makes the patients be able to swallow better. Patients are, I like it a little bit more. This one has a lot of sideways movement in addition. But the problem is the mouth can open. And so the ones that allow the mouth to open, sometimes when even though they're forward and they open, you kind of lose control of the effectiveness if they open too wide. So anytime we do a device that allows the mouth to open, we always add, and I don't see them on this slide, and I just now realized it's not on either one of these slides, but usually we have little hooks that come out on here so that we can put rubber bands between the two arches to control how much they drop open possibly at night when they're asleep, and that can make a big difference. But this one's really, really good for claustrophobic patients who need opening. And if you can't make it fit real tight, then if the mouth is going to open, you can make the device so it doesn't fit real tight. And so that way, if you have minimal undercuts, teeth that are really short,
really short, straight teeth, something that is going to be hard. We haven't talked about the tap yet, but if you make that same person a tap, it's hooked together. So
right.
If they just yawn a little bit, they'll complain that one or the other is popping out. With this one, they can move their jaw a little bit, and it doesn't come loose. So that might be, these are all in the more or less and the pros and cons. And I would say, Guy, I think most dentists understand this. They just don't think about it. I would encourage you to make one for yourself and wear it for yourself. Get yourself one of each of these 5 devices made, and you'll eventually you can use them as a model or something like that in your practice, and it makes you a better doctor when you do that.
And any device that allows you to open is a little bit better for patients who can't breathe through their nose. We want to try to get people to breathe through their nose, and we even talk about using mouth tape and all kinds of stuff to get them to breathe through their nose. But if you can't breathe through your nose and your mouth's locked together, it can be very claustrophobic for some patients. On the right side of this, I think that works really well for most bruxers. Severe bruxers, maybe the tap or something, or the Panthera we're going to talk about certainly might work better. And aesthetics, I put that up there because some patients just don't like they look at this thing and the metal, and they worry it's going to bother the cheeks. I see someone actually, Rich, put in, does it bother the cheeks? I have to say that's a rare occasion that it does. It does happen, and there's a little rubber, to answer to the question up there, is there's little rubber comfort caps you can snap over these screws, or little rubber gasket-like things that snap on there, and that helps a lot. But I would say, I would have thought everybody might have a problem with this when I first started doing it, and it's, I don't know, Rich, in your experience, it's not real often that someone says that those bars bother them. Is it in your office?
No, and you get tougher. We tell them, you'll get used to it. It's kind of like, if I gave you a rake and told you to go out and rake for an hour every day, bother your hands for a little bit, and pretty soon your hands get used to it. Sleeping on the side, I get my hands underneath my head like that. That's probably the biggest time we have that. So we just try to get patients to get a real soft, skinny pillow and make sure that goes between your hands and your cheek now, something like that. So there's a couple of little things that you can work around, but most all of these things you can work around.
Yeah, I see another question or comment. You can use tape instead of the rubber bands. George, hey George, how you doing? Used to practice next to George 30 years ago, so that's a suggestion. I know that that you've used that, and I know other dentists do. And if the patients don't mind it, that works as well. But you still may lose a little bit of the vertical component and control without the elastic. So again, it's the universal device to some extent. I would say in most cases, if you're doing a Medicare patient and you think, I don't know which one to do, then when in doubt, I would do the Herbst, because most patients can readily tolerate it. Okay, the tap. Rich, I know that you've been a tap fan for longer than I can remember, right? You and Keith in Texas, they ever go way back, the inventor of the tap.
Yeah, Texans, we got to stick together, So. That was the first one I learned, Guy, and I think a lot of this is the first one you learn, well, you kind of, you stick to it. We always teach now, I'm not sure exactly how you do this, Guy, but I say, you know what, just pick 5 devices and make 5 of each. And after you've made 25 devices, you'll be pretty dang good at it. If you do that and you review this webinar in between every 5, you'll really start thinking about it, and it will make you a better practitioner for how you do this. But Keith Thornton started doing this, gosh, a long time ago. I was back when the tap 1 had the little thing that stuck out of your mouth, and then they went to the tap 2, and then they went to the tap T, and then they went to the tap 3, and then the tap 3 Elite, and now the Dream Tap. So they're all basically the same, but we'll talk a little bit about them.
This is the tap 3, and I know that DSG makes the tap 1, tap 3. I don't do the tap 1s anymore, I wouldn't think, too often, but the tap 3 and the Dream Taps are the ones we do. They both work by having a hex wrench you put in the front, and if you all can see on the screen, there's a little hook. On the tap 3, the hook's on the top, and you turn the hex wrench clockwise, and it moves that hook forward, which pulls the jaw forward. Each turn, 180 degrees, is roughly a 1/4 millimeter of advancement there. The Dream Tap, what they did is they flipped it around. So now the hook's on the bottom, and then we have this bow across the front. And so you have to turn this one the opposite direction. So if you switch to the Dream Tap, make sure you tell your patients go counterclockwise. It moves that hook backwards, which moves the jaw forward. Both of these come with different size hooks. There's 3 size hooks that you can use, so you can get a really long range of adjustability with the tap, because you can start with the longest or shortest hook depending on which one you're doing, and you can take and replace this hook on here as you go through with it. So the tap, I think just a few things on that is whether we're talking about the Dream Tap or the Tap 3. It is one of the most researched devices out there. When you look at a lot of the studies that they use to validate how well these work, they were done with taps. And Rich and I have had this conversation. They just seem to work. If I had a patient who has really severe apnea, and we really want to do everything we can to get their apnea under control, a tap is a really good choice. I think partly because it locks the jaw together and doesn't allow that vertical opening. And it helps us to really help their airway. It just seems to work.
Yeah, we don't really know why. Keith says he knows, he just won't tell anybody, which I don't believe that either. When you think about you're pulling from the front, or you're pushing from the side, or you're pulling from the side, so we have different devices, and we'll talk about that. For some reason or other, at least right now, it appears that the tap seems to work a little bit better for the severe patients. That's not me saying that. That's most of the research. Now, we don't have a lot of studies, Guy, where they compare one device for the other with the same types of patients. So we just don't have enough information out there when we talk about this. But we will talk about the mechanism for how that works. It doesn't matter if the plate is on the top or the bottom. Okay, it really doesn't matter, other than you'll turn one way and you'll turn the other way when you go to move your jaw forward. But I use these less, Guy, when the bite is class 2-ish and very deep. And the reason for that is I can't get the lower jaw forward until I get at least open past the upper teeth, and for some people that's 7 or 8 millimeters. And the tap seems to have a little bit more of that vertical. So now I'm like this. So a patient might feel like they're this far open when we try to do that. Now, at the same time, sometimes I want more vertical. When I see really big tongues and people can breathe through their nose pretty well and they have severe disease, that's almost a slam dunk for me. I'm using the tap in that particular case. I have made these with just 6 or 7, 5, 6, 7 teeth on the top and the bottom, because you can use that. We'll talk about the types of materials later, but you can use a thermocryl type of material that really can grab onto these. And we talked about, you mentioned it before, Guy, where it only hits in the front, and now it kind of acts like an NTI, because you talked about with the Herbst, maybe severe bruxers, maybe we don't use that one. Again, you got to weigh all of these things when you're thinking about which ones of these devices you're gonna make, and hopefully we're giving you guys some pretty good ideas about when we might use one over the other.
One question up there, which we'd rather do it on the top or the bottom? It depends on the teeth. The upper, if you do the Dream Tap, which is the hook on the bottom, and the wire on the front, it puts a little more pressure on the upper anterior teeth. And so if those are weak or anything like that, then
or they have veneers, there's a bridge, or they really flare out.
Yeah. Then do the Tap 3. So that's really the key. It puts a little more pressure up there. I actually prefer the Tap 3 more than the Dream Tap, but we do both. And the other question that comes in, doesn't it bother the tongue space? You would think it would, but I think the tongue must just spread out. I don't, you think, well, you got to have a hole there for the tongue to go forward. That sounds logical, but it doesn't. In reality, we've had these devices really work well at reducing the AHI on patients. The fewer teeth, use your brains a little bit here. I mean, if they play hockey and all their anterior teeth have been knocked out, then probably not the best device. But if they're missing their molars, then this is a great device. If they got premolar to premolar, then think about where you have to engage here to hold on to. So when we say fewer teeth, it means fewer. If they don't have molars, this works out fairly well because you're hooking on the front teeth. And I think the biggest one for this, I think Richie mentioned it, but I want to mention it myself. I'm a mouth breather. I've had my nose has issues. I can wear the tap, and I've gotten used to it. I actually have worn the tap. But when I first put it in, it's really claustrophobic to me because I've got a lot of saliva. I'm used to breathing through my mouth, and I just feel like I can't open my mouth. And someone who's really nervous about that, you're going to have, that they may not like it. And if they don't wear it, it doesn't work. So we got to go back to compliance. And I would say overall, it takes a little bit more getting used to than the devices that allow you to open and swallow and things like that. But once they get used to it, darn if it doesn't just work well, and it's easy to adjust. You can even adjust these during a sleep test if you have technologists who are trained to go in there and turn and you can wake the patient up. So my severe cases, if I think they'll tolerate this, it really is the first one I would probably select, the more severe the apnea is.
One thing we do too, Guy, I'll tell you is, when people look at that and they go, man, I don't know, I say, okay, we're going to plug your nose up, and I want you to bite your teeth together, but I want you to breathe through your mouth. Okay. So even biting their teeth together, they're like, oh, okay, I guess I can get some air through there, So when you look at them, you think, yeah, okay. But these are all things that patients will talk about, that you'll want to, the more knowledge you have, the better this makes you at all of those things. And I think I'd be lying to you, Guy, if I said I never made one and then had to switch it, to another one. We do that occasionally, not very often, because most of the time people get used to whatever you make them at about 3 or 4 weeks, just like you said you did with the tap.
Yeah, while you're saying, I think important here, it really is the confidence in which you talk to your patients too.
That's a very good point.
I've had a few associates over the years, and one of them like, oh, here's 4 devices. Let's talk about all these devices, and they're all wishy-washy. And well, I guess that one's okay for you. I do my exam, and we're going to talk about the device selection coming up. And I say, you know what, Mr. Jones, here's the device I think will work best in your situation, and here's why. And I hand them one. You need a model device for all these. They need to hold it in their hand and say, here's what I think you should wear and why. And then they go, okay.
Very good.
They've bought into it. And I think there's a big, psychological component there, as if you're going, well, this may work, it may not. I hope you can wear it, and you've already put doubt in their mind. So that's probably as important as anything we're going to talk about. So
I agree. It probably is the most important thing you can talk about, other than making sure they have enough money to pay you.
Well, there's one more question about the tap. I'll just address it now. Why do we use it for the severe cases? There's 2 reasons why I use it. It just seems to lower the AHI as good or better than anything out there, and that's just really more of our opinion. Like Rich said, also Keith Thornton has some studies that say that that's true, whether that is, or Keith studies. And
so far it is. So far the studies say it is true, but right. We don't have it where it compare this device to that device, right, with the same patient or something like that. So when you just look at all of the studies and you look at which ones work the best on severe patients, it's always a TAP study. So that doesn't mean that you can't make somebody a Herbst and it might treat their severe sleep apnea perfectly well. We're not here to say that at all. We're just here to say,
I've had all these devices lower really severe apnea down to below 10. Everyone that we're going to talk about today. So let's just say that. Right. It doesn't always do that, but they all work.
Even this one, the EMA, people look at this. Sometimes my patients go, that looks pretty simple. And you go, yeah, that's right. We like simple, we really do. And I had a lady come in the other day, Guy. She swore to me that she had worn that thing every single night, and it was 10 years old.
Wow.
So they look cheap, but they can last, you know, and let's talk about them.
Yeah, so they work by having these what is Bisacryl? Am I saying that right? Yeah,
Biocryl.
and Bicryl, sorry, and they're basically suck down material. They're very small. We have different band lengths and different band rigidities that you can switch here. So you have everywhere from soft, which is the white, yellow, medium, blue, firm, and the extra firm, and you have these 9 lengths that you can choose from. So the buttons are typically put, I don't know if I have that next slide
on the canine and the molar.
Yeah, there we go. On the canine and the molar, and we can control obviously how far forward it is by the shorter the band, the more forward they are, and then the more rigidity the band has, the less it's going to get stretched out over time. I typically use the blue bands towards after we figure out which length. I might start with the yellows or whites for comfort, but they stretch out too much. The blues seem to have the right balance in most cases of holding up, but the patients are able to get them on there. Occasionally we'll use those clear bands. Let me back that slide up one moment so you can see it. Occasionally we'll use these really firm ones, but they're really tough to get on and off.
They are very stiff. Yeah, they
very
really
stiff. So what's the advantage of this? You know, to me, I think you just look at this and think, okay, wow, it doesn't look like as much as there. Wasn't that a good thing? If we can move your jaw forward and put nothing in your mouth, we could somehow, you know, magically just move your jaw forward and not have anything in the mouth. That would probably be the best way of doing it. So don't underestimate this device just because it looks small and there's not much there, because the less it's there, the better off we are sometimes. So I think the biggest advantage of this one is patients that are really kind of apprehensive about wearing all this metal in their mouth and concerned, that they look at this and go, oh, that kind of looks like my Invisalign trays, or kind of looks like a mouth guard that I've been told to wear for a long time. And I think patients really like this, the smallness of it, and there's not as much on the cheeks. It's just a very small device. We typically make them with this little pads in the back to open up the bite a little bit, to allow a little bit more room for the tongue to come forward, because they are so thin. You want to open it up enough to get the vertical opening that you would need, and so it works great. The biggest disadvantage to it, I would say, of the devices, even though you have one that lasted 10 years, I would say it's probably one of the, it can break a little bit more readily than some of the others. And I would also say that if the teeth are really diverging, it's hard to get this to seat, because it's, hard acrylic, and you'll get it to seat and then it'll be loose. That's why we have that over here for the crowding. And then these buttons, we have a little bit of limitation about how much we can advance this. So if they're really class 2 in particular, maybe class 3, you may put that longest band on there, and you're still really, if they're way back here to start with, and they barely even come to end, let's say, you may put that longest band on, and they're like 80% of the maximum protrusion. Unless you do something fancy at the lab, make sure you let them know and move those buttons around. You can end up being in a situation where even the longest band's almost fully advanced for the patient. What else do you have to add on that, Rich?
Well, you mentioned the snaggle tooth. If you think about, go back to your dental school days and you're going to get a surveyor. Remember that little thing guy? You probably didn't even have to make a partial when you went through dental school.
I did.
But, you put the 10,000s on the 20,000s, you go around. What happens when people have really, really snaggle tooth, that height of contour is so high that you don't have any plastic, left to hold that on. So, you don't like really straight, really short teeth for dental sleep devices, and you don't like really crazy, wild, nasty teeth. You like just kind of normal. You like little bits of, this and that. Because remember, this thing's got to kind of snap on. It doesn't always snap, but when you put it on, you want to have to, pull it off a little bit. So you got to play around with that a little bit as you learn how to do this. But, there are a couple of questions, Guy, about mouth breathers again. And I love this particular device for people who have less nasal patency. Where you get in trouble is if they're a class 3, because now, we don't make rubber bands that short, and we don't have that much range of motion. And you got to have molars too. I've made these, Guy, for people who had molars, and then I put it in their mouth and I go, Well, that was pretty stupid. There's nothing to hold it down in the back over there.
Yeah.
Oh, I'm sorry. Yeah, they're missing molars. If I didn't say that right. They're missing molars on that lower right. And you see where that rubber band is, on that lower right. There's nothing to hold it on there. So it didn't work as well in that particular instance.
Yeah.
The other thing, Guy, too, I will mention is, this is the least expensive device that you will pay for as a doctor. And when I first started this, I passed on that savings to the patient. And I would have my devices out and I would say, you know what? This SomnoDent at Herbst Advanced is the device for you, just like you taught me, right? Hey, say it with conviction and be firm about it. And they'd go, well, that $100 is $100. I'm kind of liking that EMA over there, the one with that. And, sometimes I'd have patients talking me out of it because of that. So now we just say, hey, look, they're all the same price.
Right.
It doesn't matter. We don't tell them that one costs more than the other.
Yeah, and I think, but it is good to know what you pay for these at times. And so when we talk about billing next time, we will talk about a way to adjust the fees based on the services you're providing. One of the questions that came up there is, do you give them these bands? We'll talk about adjusting here a little bit. Once we decide the definitive position, exactly which band that they have, which length rather, I give them usually about 8 or 10 pairs or 6 to 8 pairs of these that'll get them through a year because they stretch out. And what I love about this device is that patients will come back in for their annual recalls. They'll call up and say, hey, I want some more bands. You haven't seen you in 12 months. We'll be happy to give you some, but you've got to come in and let's check you out, make sure everything's going okay. So I like that. I also like this for anybody who's got allergies to metal, and sometimes people who really don't take care of their teeth as well. If they're, hygiene's bad, there's not all those little holes and grooves in the metal for all the gunk to get in on these as well. So I think the bottom line on this one is don't underestimate the CMA. It doesn't look like much, but it does a whole heck of a lot. It can really be a great device for you and your patients. All right. Now, let
me add one more thing on that real quick, Guy, because we had a couple of questions about the bands and do you charge for them and stuff like that. So we don't charge for them. We give them just enough to get them through a few months, just like you talked about, because we want to encourage them to come back for their follow-ups. For those of you who don't know, I used to fish a lot more before I met Guy, and he made me work more. But, now I take the little Plano tackle boxes that are about this thick, and now we have like all the whites, from 15 to 22 and all the yellows and then all the blues and all the clear. It's a perfect thing to put those bands in. And we just put 2 in a little baggie, that are marked. And then when the patients come in, we know what we want to give them.
Absolutely. And you charge for them because we charge for the annual recall visit, but we throw those in as part of the visit. And if you buy them in bulk from DSG, they're a little cheaper, so you want to just get enough for all of them, like Rich said. All right, that's good. I'm glad everybody's paying attention and asking questions. If we're missing any of the questions, a lot of them are coming through. We will get to them before we'll go through and we're finished. Make sure we didn't miss any. I know our team, thank you, our whole team of DS3 dental sleep experts are answering some of the questions to help Rich and I out as we're going through this. The dorsal design of SomnoDent Dorsal and the Fusion. These are both called dorsals because if you look, this kind of looks like a dorsal fin on a dolphin or a shark or something. Me personally, it's one of my favorite designs as far as devices go. It's one I wear most nights myself. And a lot of the same things you're going to say about the Herbst, you could probably say about the dorsal. But let's kind of talk about how they work first, and we'll go through the pros and cons. The typical SomnoDent Dorsal by DSG works by, you have a little key you put in here, and you turn, pull this little screw in the direction of the arrow, and it moves. You can see my mouse there, right, Rich?
Yes, just that front piece there.
It just moves that forward. Of course, you're going to want to do the same on the other side. Each time you do that, it's just like 1/10 of a millimeter. And this will go about 5.5 to 6 millimeters, depending on where they started. So that's the typical dorsal, the one that we've been doing for a long time. The fusion is essentially the same thing, except for these wings you can take on and off. So if you get out to that 5.5 or 6 millimeters and you want to go further forward, you can put a different wing on that goes that's in a different position, so it allows further advancement. So if you got somebody that's got a really big range of motion, the fusion just lets you advance it further without having to send it back to the lab or modify the device. So essentially they work the same. They're both dorsal designs, and a lot of the same things you could say for the Herbst are the same for here, because you can open your mouth. So that makes it good if you're claustrophobic. It makes it good if you're nasal. If you feel like you're going to be claustrophobic and you can't breathe your nose as much. Minimal teeth. It doesn't have to fit as tight, or the retention issues we talked about. That's great for that. Aesthetically, it's a little better than the Herbst. I think people don't like that metal on the Herbst. It's just a nicer looking design. It's very comfortable. I know that for me personally, I wear it a lot. I would say the negatives, it doesn't allow that sideways movement as much as the Herbst does. So if you're going to really big time grinder, maybe not so much. And depending on where those wings are, we have this class 2 or 3. As you move it forward, those wings can kind of get worked forward to where now they're kind of poking, up into the gum and kind of holding the cheek out. And the limited space in a maxillary vestibule, that's rare. But occasionally, if you have someone who has that coronoid process that's kind of tilted in, that person that would be really hard to prep the buccal of number 2, there's no room back there, they might get a pinch in that area due to this mechanism. I should mention that's probably the only time we've ever had trouble with the Herbst Advanced too, as if they're really, really, really tight back there. And it's not very common on it. So a lot of the same things that the Herbst has, with the advantage of being a little better aesthetically, a little smoother, not to worry about the bar that some people worry about, but as we mentioned, it's probably not as big an issue as most people think. So it's not Medicare approved though. So if I had a patient that I thought the Herbst was a good one on and it wasn't Medicare, I might gravitate towards this for the patient instead of the Herbst, because of the smoothness of it, the aesthetics of it, and so forth. What else, Rich, do you have to add on that?
That was great. That was good. That was a good summary. The only thing I will tell you, the lab people don't like us saying this on our webinars. DSG doesn't want us to say this, but you can modify these things a little bit. If that you gets too far forward and that shark fin is sticking up, well, just round it a little bit and shorten it a little bit. You got to be real careful, because that back upper corner is where those things can fracture. They can. So you have to be careful about grinding too much of that off. How we just give that the finger test, Guy. We have the patient open just a little bit, move out just a little bit. You just put your finger back in there, and I need to be able to get just about the width of my finger. I don't have too fat a finger, in that between that coronoid process and the buccal of the upper posterior teeth. But that's good. I mean, all of that's good. And like you said, we made ourselves all of these, and I find myself wearing the dorsal or the EMA quite a bit. I have one of the D-SADs just recently, and I certainly liked that one too. We haven't gotten to that one yet because we can make it a little bit thinner, and we'll talk about that in a minute.
Just a second. One last thing I would add, always consider having the hooks added for this one too. So on occasion, you need to add elastics to keep the mouth from just dropping open. It can make the difference between this or the Herbst device from working really well and maybe not working quite as well. So the hooks are great. And you can do this even because of the design here. It's not pulling the top down. You can do this on an edentulous patient. If you want to know how to do that, we have videos on that. And the SomnoDent Edentulous really works way better than you ever think it would. I probably do a couple of these, 2 or 3 of these a year on edentulous upper patients. Not for lower, not the greatest for lower still, but if they're missing their upper teeth, this works out fantastic. So, and then the last one we want to talk about is really the latest, greatest device out there. It's I would say the most new and new innovative device. It's a 3D printed device, Panthera D-SAD. D-SAD stands for Digital Sleep Apnea Device. So it's a 3D printed device that has different lengths arms that you can that they supply you with that you just pop off and pop on here, and as you shorten the arms, it can pull the jaw more forward. It's a very, very thin device. We'll talk about the pros and cons in just a moment. You can get this in basically 3 designs, where it just hits in the back with an anterior opening, where it just hits canine or premolar to premolar, kind of if you want that deprogramming part. I'm sorry, I'm pointing the wrong one, the deprogramming part. Or you can get it to where it hits all the way around, and you just need to tell them which way you want. So all the way around, open in the front, or more like just in the front. And also, you can talk to them about how much you want to wrap the anterior teeth when you do this as well. So a lot of options to go through. I think I saw something, Rich, that came in. What do you do for the people who are big time bruxers? This is the device. If I know they're going to break it, they're not going to break this one. So this is the device I'm going to do. If they come in and I know they're looking like they've got the big mass of their muscles and their teeth are all chipping, and could tell they've been a lifelong bruxer. This is great for them. It's very thin, and you would think it's going to break when you look at it. The patients would look at it and go, "My gosh, this thing's about as small as an EMA in many ways," but because of the technology and the 3D printed, it really, really holds up well. I've not had any problems with these breaking on any of the patients, no matter how big time of a bruxer that they are.
Yeah, I like to take mine, Guy, and put it out in the driveway and run over it with my truck. I'm not even sure that would break it. These things they're amazing. You can twist them and move them like that. They're just not brittle at all. I'm sure that you could break them, but like I said, the Narval. I was a big fan of the Narval that ResMed made, and then they took it out of the U.S. market, and DSG is now making this Panthera device that they call the digital sleep apnea device. So you'll frequently hear it referred to as the D-SAD, okay? And all of the things that we talked about with the Herbst and the EMA and the Dorsals really apply to this as well, because we're making this very small. Remember, when we have to get retention on the teeth, we want as much retention as we can get on the posterior teeth, because they have bigger roots and they're going to withstand, those forces better than the front teeth. So this goes back to what Guy was talking about before, where we have all of these design options. So don't let that scare you away from making this device. Call up DSG. They have sleep experts. They'll walk through there which one might be the best. But remember, somebody has a bridge up in the front and they're missing 8 and 9, and the bridge goes from 6 to 11. Well, don't wrap the front teeth. Right. They got implant. They're all implants, man. I fell down, and I got hit and knocked all my teeth out, and now I have implants. Well, don't wrap them. Put as little retention as you can on those, with that. So, but don't let that scare you away from, not knowing which type of those wraps to do. Don't let that discourage you from doing it. Just pick up the phone in a couple of minutes. They'll help walk you through it.
It really, the question would be, why don't you do this on everybody? The biggest problem with this is if the person has an unstable dentition, and you're going to be doing a lot of dental work down the road, you can't add to this like other acrylics. You can modify it somewhat, but it's very thin. So, you can only grind on it so much. So if you think they're going to have a lot of dental work done, then it's not the best device. It's a little more expensive. I don't know the cost, and my team takes care of that. I'm sure DSG or someone can answer that for you. It is a little more expensive, but like Rich said, we pretty much pick the best device for our patients. And if they're a big-time bruxer, fairly stable dentition, this is a great device, very comfortable. It's all around, I would say, one of my favorite devices to do. All right, let's talk about device linings. We got about 10 minutes left here, and we're going to breeze through kind of what we do after we deliver it here, because we spend a little more time on the devices itself, since that's what we were mostly wanting to talk about, and we'll get through all the questions as well. So the device lining. So what touches the teeth? When you're talking about the SomnoDents, so whether you're talking about the Herbst, the Dorsal, the Fusion, the regular Herbst, or the Advance, it comes with hard acrylic and clasp. So the hard acrylic is nice. You can add acrylic, you can grind on it, you can tighten or loosen those clasps. to make it fit tighter or looser. And then they also offer a flex material, which is like a rubbery material, kind of like a gasket. And I have to say it's the nicest flex material on the market. It really holds up well. It's a nice cushy material. I like it for comfort for the patients if they're really concerned about comfort. I don't like it if you're going to have to do a lot of adjustments down the road because it kind of gunks up. It's hard to adjust. And the device has to be just a little bit thicker if you're going to have the acrylic and then the rubbery flex material. But all in all, I do a lot of the flex, I would say, and some of the hard acrylic and clasp. Any things on those?
It's just more comfortable. You know, I've worn both of them. You've worn both of them. Most dentists that we talk to have worn both say, you know, that flex is just a little more comfortable. So bigger, longer teeth, you know, where
Undercut,
I don't have to worry about that. Yeah, I can do that. But like but you can't, you know, if you got to do 3 or 4 crowns on the upper right, you know, you can grind it all out on the upper right and then put acrylic in and do it. That's a lot more work than just starting with acrylic or something like that. But those are really your options, you know, with the SomnoDent Herbst, the Dorsal. Remember, the Fusion is just the Dorsal that has the little replaceable wing on it. And then the tap. Yeah, when we get into the tap, DSG is unique. There are not very many labs that make the tap out of the Bruxelles type material, and that's the type that you heat up and it gets a little bit, you know, soft when you do that. So what that allows us to do is to take shorter, straighter teeth and maybe grab onto that a little bit, you know, so when we heat it up, then we can put that thing in and it will grab on a little bit better. And then, of course,
to be clear, the patient heats it up each night a little bit before they put it in, allows it to go in. As it cools, it fits tighter.
Correct.
The plus, they call that, is what some of you might think of as Bruxelles material, but it's really great because it makes it go in easier, but now it stays tight, right? And then go ahead. Yeah,
and the triple lamin is similar to the flex type material and the other ones. It's got the little soft spongy part on the inside. And then, of course, my new favorite guy is this Accutherm. It is the suck down type of BioCryl, I believe it is. And then they put a very thin layer of thermocryl on that. And thermocryl is a heat activated material. This they do not heat up every single night. This is something that you might heat up when it comes back from the lab and you would try it in. So when you heat it up and it gets clear, it gets soft, kind of like a, I don't know, what would you say, Guy? A sticky.
Like he mixed up acrylic almost, like a putty when it's at the putty stage.
Yeah. And then you push it in real hard, and the longer you leave it in, the more retentive it is. So, you know, it's one of those where it's like 10 seconds, tease it halfway off. Another 10 seconds, tease it halfway off. Then a little bit more, you know, if we want it to do that. So
you can always adjust it too if they've, you know, if you want it to fit tighter, they come in as loose. We can make it tighter, looser. Even if they have a little dental work, then we can usually refit it around it. It's a great material. It does discolor a little over time, so you can usually clean it, but some patients object to that. So those are your 3 choices with the tap. EMA, we already talked about. It's BioCryl, comes in one material. And then the D-SAD or the Panthera, same things we're talking about there. That's the 3D printed. It's a CAD-CAM polymer, nylon, organic polyamide 12. Boy, do I sound important when I say that. It's a 3D printed material, very thin, very light. You pick this thing up and it weighs nothing, and it's really quite strong considering. And so if you want to, you know, I think we've given you a lot. This will be posted again live. I'm not live, but recorded. The live version will be we recorded today, and then we'll post it, and you can review it. But also, if you contact DSG, I forgot to mention we have a special offer for them coming up in just a moment too, to save you $50 on a case. So stay tuned for that in just a moment. But they'll give you this guide here that kind of goes through a lot of the stuff Rich and I have gone through about which device to do well, do where, and kind of what the adjustments are. Because I know we just bombarded you with a ton of information. So contact Dental Services Group or your local rep or the number we're going to give you in a little bit, and they can get you that guide. If you decide you want to consider joining our services, DS3, we have a program Rich and I wrote to where you kind of put in the various devices, and we put the devices in. You put in whether they're Bruxer, big tongues, lower molars, a lot of stuff we've been talking about, and you hit sort the devices, and it gets you in the ballpark. It gives you an idea of how to evaluate these things. But I think one of Rich's famous saying is you still got to use your brain. We can't account for every situation that you utilize. So use our device selector, but also just go make these as Rich has mentioned. So
just do it. We hate to borrow the Nike slogan because I'm not a big Nike fan after a lot of this stuff. We try to keep these apolitical, but I always have to say something I'm not supposed to say. So there you go, guy. I said it. Okay. The other thing, Guy, I think it'd probably be best, with the cost, since you or I really don't even know. Let's just have them reach out to DSG, and they'll give you prices on all of these.
I think Michelle answered it up here, if I'm not mistaken. I think I saw it go by in the questions a minute ago. So.
Yeah, I think it's probably best that they just reach out and do that. So because I don't really know. Right. We did have a question there about scanning, Guy. Absolutely. I know you and I both use the CareStream. I've had some experience with the iTero that has worked okay. The CEREC, I don't know that much about. I know when we looked at doing it, that CareStream was the one that I bought when I did this.
I tell you, it's been one of the best investments I made. It just saves us time and it improves our workflow. Really, from the time we do a consult, we just go ahead and scan them that day. We get the cases back quicker because there's no mailing of the information, and they see better because you don't have all the distortions and possibilities, all the many problems that can go wrong when you're pouring up models, doing impressions, getting drags, all that kind of stuff. And the patients are completely wild. If you want to learn more about what we do really, I would say, the most practical, hands-on dental sleep courses in the country. It's a 2-day course. You get a dental device made by DSG. You get a sleep test, and you get a day, 2 days of education. And it's not just way high level apnea and why it's bad for. It's how you do this in your practice, how you screen, test, treat, and bill your patients. And you will leave with the knowledge on how to get back to your offices and get started doing this. The fee is $9.95 for the dentist. That includes a team member. If you're a DS3 member, you get a discount. And if you want to look at the dates here, we're going to Michigan, Kansas City, Clearwater, and then we also have a billing course coming up right here in Braden, in Florida, 14 hours of CE. And I think if you type in course, they're going to give you some kind of a discount on that. I don't see it on the slide, but if you type in course, we'll make an executive decision that they'll give you a discount. Our team will talk to you about when those are, and just put in which one you might want to come to, or if you're not sure, just let us know. And then here's the billing course that we're going to be doing in conjunction with our study club meeting here in Braden, Florida. Lisa is our director of 4-pillar billing. She's the manager there. She's got 20 years of medical billing experience. We do the billing through 4-pillar billing for hundreds of dental offices doing dental devices. So if you type in billing now, you'll save $50 on that course as well.
And don't be shy about sending your staff to that. You don't have to go to the billing one, but you better have somebody in your office that knows how to do this, because we just can't emphasize enough that the billing is challenging, but it's not daunting. It's when you first get into this, it's probably the single biggest reason that dentists get back out of it. Because they just couldn't get the billing thing, but they wouldn't hire anybody to help them do it either. They hired somebody that didn't know how to do it. So, if you're serious about this and you're serious about doing it, that's a great course. And, Guy teaches most of these. And if you haven't been to a course that Guy teaches, you're in for a real treat. He has a way of taking something that inherently is a little bit complicated and making it, simple and understandable. And I will also say, Guy, that it's the cheapest way I know to get a sleep study and treat it.
Yeah, and Rich is talking about the hands-on courses. Again, just type in course, and our team will get in touch with you and let you know. You can get a dental device and a sleep test for for less money than it would probably cost you to go somewhere and do that. And then the billing course is October 5th, where Lisa and team will be teaching that. I promise you, you'll come back from that going, wow, that was well worth the time, you or your team. And then the symposium that we put on, Jason Tierney, our COO, works very hard on this every year, and it's his meeting, and I don't know how he gets all these people to come every year, but it is literally a who's who of sleep, and everybody from the founder of obstructive sleep apnea, John Remmers, to Rich, you and myself, Jameson Spencer, Steve Carsonson. We've got a really special guest coming this year, Ryan Holiday, author that a lot of you have heard about and read his books, going to be talking about how we get around the obstacles of dental sleep and life. It's going to be a great meeting. It's our 4th year of doing it, and we sold out the last year or two, I think. So if you want to be interested in that, here's the information. You can register at ds3.com. Symposium. It will be a great meeting. This is what we do. Rich and I have spent the last dozen years or so of our lives, probably, I guess, when we first started working on this, on trying to help dentists bring sleep into the practice. So if you want to have help with your screening, testing, treating, and billing, we provide that through education, coaching, software, and support. If you don't know how to bill, if you don't know where to go to learn more about, so I saw some questions about what do we do once we hand them the device? Do we have to do a follow-up sleep test? We're not going to have time to address that tonight. We can help you with all those questions. And if you want to know more about what we do, just type in consultation. And even if you have a question that we didn't have time to answer tonight, one of our team members will get on and with you to answer your questions and just help you with whatever challenges that you have in your practice.
You do not have to reinvent the wheel here. You just don't. We don't charge very much money at all for what we do. We have the best reputation of anybody in the world who does this to help dentists. You can ask anybody out there. Guy and I have spent the last dozen years, like he said, developing a team and a system for how to help dentists do this in their practice. And we will do everything we can to help you get going and get over we call them speed bumps. There's just little speed bumps as you go along. And, I would encourage you to reach out and get some help.
Right. All right. I tell you, we're going to have to speed through some of this, so forgive me. Just going to run down here to, we just got to talking a lot more than we normally do about this. So I want to jump down to our next webinar and then make sure we get to the DSG special here. I know there were some questions about follow-up sleep tests when we do that, how we manage side effects. Well, stay tuned. We're going to get to those in a different webinar, but I think we had a lot of good questions. So I think we got through the devices, as we said. The billing, that's what we're talking about next time, October 1st, or come to the billing course. I think it's October 5th. By all means, you will learn a lot at either one of these. So 8 o'clock again, Eastern. Make sure you register for that. If you want something ongoing and free, come to our dentalsleepinsider.com. Go there and register, and you'll get a free magazine. Every 3 months we publish this magazine with just great information about everything from billing to dental devices to tricks or ideas to help be more efficient in your dental sleep practice. So we got our new version of that, newest edition rather, is coming out very shortly. I think you'll find a lot of great information in that. And then here's the DSG Dental Services Group special. You need to go to dentalservices.net/DS3, and they're going to give you $50 towards your first case. So I think that's a pretty good deal there. Go ahead, it costs you nothing to go and register for that. You'll get this information, the guide and everything that we talked about as far as the selection guide. So you don't type into our question box. Go to dentalservices.net/DS3. I'll leave it up there for a few moments. to get your $50 towards your first case. So it's our DSG, DS3 CE exclusive. So I think, you know, one thing Rich said at the very beginning of this, if you want to learn how to do this, you know what you need to do? You need to do it. Make one of these devices on your friend, your neighbor, yourself, your wife, your husband,
your hygienist husband, I mean, I promise you, you don't have to reach out far. You can go to your office tomorrow. You're going to find 3 people tomorrow, right, who would love to have a dental device that you'll make for them, and try to talk them into paying the lab fee or something, so it doesn't cost you much. But even then, I'd still do it for free, because the learning curve to this is not that bad. I mean, it really isn't, especially if you team up with somebody who can help you do it. So
absolutely. All right, well,
it's going to be a good resource for you as well. They have sleep experts that can help talk you through some of the things that we talked about. We record these webinars, so if you want to come back, go to our YouTube channel, and you can read that. I imagine that Dental Services Group will have a link to this somewhere as well, if you want to look at it again.
Yes, absolutely. And here's how you can get a hold of us if you need be. And let's see, Rich, 6 minutes over, not too bad for us. Oh, that slide went. There we go.
No, thank you and Jason for putting that together. You guys always do a great job. I know we didn't get to some of that stuff about the side effects, but again, we could talk for side effects for 3 hours, So we will do another one before too long on that. And don't hesitate to reach out to us or DSG if we can help you in any way.
Right. I think we got most all the questions. I don't see any that are unanswered on there, Rich. Did you see any other ones that we missed? All right. Anything else? I think that'll cover it. All right. Well, good to see you, Rich. And thanks everyone for taking your time to spend it with us. Make sure you tune in for our billing webinar, and hope to see you at one of the courses coming up here. I got a busy lecture schedule coming up here shortly, so I hope to see some of you all there. And in the meantime, any questions you have, don't hesitate to reach out to us at dentalsleepsolutions.com. That's what we do. Anything about dental sleep, reach out to us, and we'll either help you or point you in the right direction. So have a good night.
Thanks, guys.
All right, thank you.